Hello and welcome back to the Aslan Health Podcast. I'm Dr. Mike Hauman, and I want to thank you for joining me today as we begin a new three-part series on a nutrient that's often underestimated, yet deeply vital to your health, healing, and well-being. We're talking today about magnesium, a quiet, behind-the-scenes mineral that supports calm, cellular energy, and resilience. If your body is a symphony, magnesium would be the conductor, orchestrating rhythm, flow, and harmony. And if you think of your nervous system as a vehicle, magnesium would apply the brakes when things get out of control. And if your mitochondria, the little power generator found in every cell, well, if they were trying to produce energy, magnesium would be the technician keeping that machinery operational. So today, we reveal the details about the mineral magnesium. We'll reveal what magnesium is, why it's essential to your system, and we'll discuss why so many people are unknowingly deficient in magnesium. We'll discuss how a deficiency can influence your sleep, your stress response, your muscles, your mood, and even your heart. As always, please remember this podcast is for educational purposes only. This is not individualized medical advice, and you'll need to see your personal healthcare provider for that. This conversation is intended to inform, to educate, to help you ask better questions, to understand your body more clearly, and then to take steps towards healing, all grounded in science and stewardship. Are you fully charged? This is going to be magnificent.
Welcome to the Aslan Health Podcast, where science meets soul. Your host for this program is Dr. Mike Hauman, an experienced physician, a certified functional medicine provider, a certified insight coach practitioner, and a devoted follower of Jesus Christ. If you're tired of feeling stressed out, exhausted, overwhelmed, or stuck in survival mode, you're in the right place. So take a deep breath. Let's be transformed by the renewing of our minds. Here's Dr. Mike.
What is magnesium and why does it matter? Magnesium is what we call an essential mineral, which simply means that you can't make it and you absolutely need it. If you recall the periodic table back from your chemistry days, magnesium is in the upper left-hand corner of that table. It's right next to sodium and directly above calcium. The human body processes rely on magnesium for more than 300 unique enzymatic reactions, including those involved in energy production, muscle contraction and relaxation, gastrointestinal motility, nerve function, nerve signaling, blood pressure regulation, glucose metabolism, bone development, DNA and protein synthesis, cardiovascular rhythm, and of course, stress modulation. Friend, all that stuff is not theory, that is human physiology. But here's the deeper truth. Magnesium isn't just important in a list of biochemical functions, it's foundational. When your body is low or depleted in magnesium, there are signs and there are consequences. Sometimes you notice them slowly, subtly, but undeniably. You might feel more anxious, your sleep might become lighter or shorter, your muscles might cramp or twitch or stiffen, constipation can slowly creep in, your energy can decline, headaches can come back, heart rhythm might skip or be noticeably more labile, and recovery takes longer. None of those symptoms guarantee low magnesium, but they can often point to it. Magnesium status matters more than most people realize. First, the big picture. Let's consider 3 systems that magnesium supports most directly: nervous system, energy system, and recovery system. Here we go. Your nervous system, magnesium plays a calming role in the brain and the body. It functions like a physiologic brake pedal, modulating stress signals, reducing excitability, and buffering the effects of excessive allostatic load. So When your life hits the gas, magnesium can help you apply the brakes. Second, your energy system. Every cell in your body depends on magnesium to produce ATP. That's the energy currency of life. Without adequate magnesium, energy production falters. If you are wired but tired, your body may be asking for magnesium replenishment, called repletion therapy, not just more willpower. Third, your recovery system. Magnesium assists in muscle relaxation, in nerve function, sleep quality, bowel regularity, cardiovascular rhythm, all components of a healthy recovery response. When adequate magnesium is unavailable, your body's ability to bounce back diminishes. In our culture of chronic stress, pushing through, and overdrive, that's no small thing. But friend, you simply can't out-hustle depleted physiology. So if magnesium is so critical, why are about half of Americans running low or deficient? Well, there are 4 main reasons. First, our modern diets are mineral poor. Magnesium-rich foods like leafy greens, legumes, seeds, nuts, whole grains, they've all been increasingly replaced by processed, packaged, and refined options. They're substitutes for whole foods. When grains are stripped of their outer, more nutrient-dense layers, magnesium is lost. Other minerals as well. And the more we stray from whole food eating, the more we decrease our mineral consumption. Farming practices have also reduced the natural mineral content of our soil, lowering the minerals contained in the foods that we do consume. Second, chronic stress burns through magnesium. Living in sympathetic overdrive elevates your body's magnesium demands. If that is from overwork or excessive life demands, worry, poor sleep, unresolved trauma, it doesn't matter. You burn through magnesium faster than you replace it. Some people need better stress reduction. Some need more magnesium, and many need both. Third, some common medications deplete magnesium. For example, long-term use of acid blockers, diuretics, and certain antibiotics can reduce magnesium stores by binding magnesium, blocking it, or impairing its absorption. That doesn't mean that these medications are wrong or unhelpful, but you should be aware of the common effects and side effects of the medications that you do take. For example, medications that decrease magnesium absorption in the gut include proton pump inhibitors, drugs commonly used for acid reflux, such as Prilosec, Nexium, Prevacid, Protonix, Acifex, and others. Another category of medications called diuretics can reduce magnesium levels by increasing urinary mineral loss. These include common prescriptions such as furosemide or Lasix and HCTZ or hydrochlorothiazide. Fourthly, digestive issues may block mineral absorption. Even a meticulous diet won't help you if your gut can't absorb the nutrients in the food that you consume. Conditions such as excessive inflammation, leaky gut, prior gastrointestinal surgery, or an imbalanced microbiome, they can all impair magnesium absorption from food even when it is present in your diet. If you have a history of gastrointestinal issues, you may be at a greater risk of deficiency. So let's reveal the low magnesium clue list with common signs and patterns that may suggest your body's asking for more magnesium to meet your needs. Listen to this list and identify if any of these apply to you. Trouble falling or staying asleep, waking up tense or still tired, leg cramps or muscle twitching, constipation, increased sensitivity to stress, palpitations that have been medically ruled as benign, frequent tension headaches, post-exercise soreness that lingers longer than it should, a diet low in nuts, seeds, greens, or beans, high intake of caffeine, alcohol, or processed foods, long-term use of medications that interact with magnesium, and feeling wired but tired. Again, these are not diagnostic, but they are invitations to explore further to see if magnesium repletion is best for you. Okay, so I have some of those signs and symptoms, Doc. Should I get my magnesium levels tested? Well, that's a fair question. Standard lab tests typically measure serum magnesium. But here's the catch. Only about 1% of your body's magnesium is found in the bloodstream. The rest of it is stored in tissues, bones, and in every cell. So while a very low serum magnesium can confirm this is a problem, a normal level doesn't necessarily rule out deficiency. Other tests, such as red blood cell magnesium, ionized magnesium, urinary magnesium, and magnesium tolerance tests, they may provide additional insights, but each has a significant limitation. The National Institutes of Health note that no single method for measuring magnesium is satisfactory. However, one tip I can suggest is this. If your blood work shows that your serum potassium remains low, or you have unexplained low calcium, a magnesium deficiency should be suspected, even if your serum magnesium appears normal. That's why I encourage people to first assess their deficiency symptoms, the ones we talked about, their risk factors, their diet, and their lifestyle contributors, and then consider a trial of magnesium support if that's appropriate. This leads us to the most common magnesium question that I hear. What should I do and what should I take? Well, the short answer is improve your diet and supplement if needed. Let me briefly reveal what we will unpack in detail in the next episode. Magnesium supplements have more forms than a 3-year-old has excuses, each with different effects and varying impacts, just like excuses. You've likely seen this alphabet soup in the supplement aisle with names like magnesium aspartate, glycinate, citrate, malate, threonate, taurate, sulfate, oxide, chloride, and combinations of all of these and more. It's confusing, I know, but each form has its own nuance and can serve a slightly different purpose. Some are calming, some are more energizing, some forms help more with motility, some support the brain more effectively, and yes, some are even better absorbed than others. Next time in our Reset episode, I will walk you through each form, how to choose wisely, and how to avoid common supplementation mistakes. But before we close today, I want to reframe all of this information through the lens of stewardship. God created you as an embodied soul. You're not just a body or a mind or a soul. You are uniquely all of these. True, you are dust and minerals and so much more. You've been given the breath of life, and you are lovingly knit together by divine design. Scripture affirms this again and again. One example is 1 Corinthians 6, 19 through 20, which says, "Do you not know that your body is a temple of the Holy Spirit within you, whom you have from God? You are not your own. You are bought with a price. So glorify God in your body." Please don't chase the next health fad out of fear, or wellness as worldly wisdom, or longevity as selfish ambition, but instead pursue your best health as a faith-filled stewardship, because good health then allows you to love, serve, work, rest, and worship more freely and unencumbered. And sometimes that begins with something as simple and overlooked as magnesium. So here's a closing reflection. What if the reason you've been feeling more anxious, more tired, more tense, isn't a crevice in your character, a crack in your constitution, or a corruption to be conquered? What if the issue is simply a decline, decrease, or depletion in your mandatory mineral magnesium? What if your nervous system, your sleep, your energy, and your resilience are all quietly asking for a little support, more margin, and a little more magnesium? Well, my friend, That's the reveal for magnesium. It comes with an invitation. Consider the common signs of low magnesium, the ones we reviewed today. Then take a look at any previous lab results that you have with an eye to mineral testing, magnesium, calcium, potassium in particular, and then review your medications. Have you been on a medication for reflux or a diuretic for some time? If you are experiencing symptoms of low magnesium, it may be valuable to have a conversation with your healthcare provider and, if appropriate, consider magnesium repletion therapy. That is exactly what we'll consider next time in our Reset episode, when we'll walk through what to stop, what to start, the uses for each form of this essential mineral, and how to use magnesium wisely, safely, and effectively. Until then, if this episode encouraged you, please like and follow the Aslan Health Podcast. Then share this episode with someone that you care about. Because, my friend, we are all in this together as one body. And if you'd like useful, practical resources, always be sure to check the show notes for each episode. You will find applicable, downloadable information as well as helpful links to access our dispensary or to visit us anytime at www.aslanhealth.com. This is Dr. Mike Hauman for the Aslan Health Podcast, serving him by serving you. Thank you for joining me. Until next time, my friend, be well.